All right, I'm before y'all to give my demonstrative speech on how to take vital signs. This is my 10 people. Everybody say hello.
Hi.
All right. Nelly is she's gonna demonstrate on Rashawn. All right.
How you doing?
Hi, how are you?
All right. People often wonder why a nurse takes their vital signs when they go to the doctor or to the hospital. And the most simple way of explaining the purpose is to say that the vital signs are a baseline for doctors to work with. Being in the medical field, I know that there are ranges for all of the vital signs, and if there is variance, then there may be problems somewhere. There are 5 basic vital signs that we will look at, and I will try to briefly explain each of them as they are demonstrated. First, we have the temperature. Everyone knows that the ideal temperature is 98.6 degrees, but that is for a normal, healthy adult. I work with the geriatric population, so that their temperatures are usually lower than 98.6. Their temps can be as low as 96.8, and they're fine. The body fat of the elderly person is less than yours and mine, so they are not as warm as we are. To take the temperature, we place the probe of the digital thermometer in a disposable sheet and place it under the patient's tongue until it beeps, and then we read the number that was displayed.
96.8.
All right. Now, while we're waiting for the thermometer to finish, we count the respirations by watching the patient's chest rise and fall. Each set of a rise and fall is counted as one respiration. We watch for one full minute. Some people watch for 15 seconds, then multiply by 4. Others watch for 30 seconds and multiply by 2. There are many ways. Oh, no, wait a minute. There may be times when I watch for the 4 minutes to make sure that the respirations are regular and not labored. The normal range for respirations are 12 to 20. If the patient's respirations are greater than 20, then we feel that the patient is breathing too fast, and we have to figure out what the reason behind it is. Less than 12, we worry that the resident is not breathing sufficiently. Next is the pulse. We can feel the pulse in many areas of the body, but the common places are the apical pulse, which is heard by placing a stethoscope over the heart and listening to the beat. And then there's the radial pulse, which is being demonstrated here, and we can also do it on ourselves. We like to see a pulse between 60 to 90 beats per minute. This can be checked like the respirations by only watching for 15 or 30 seconds and multiplying by the appropriate number to equal one full minute. The blood pressure is next. There are 2 numbers to the blood pressure that represents the 2 different pressures in the arteries. The top number, which is the higher of the 2, is the systolic pressure. It measures the pressure in the arteries when the heart beats. The bottom number, which is the diastolic, is usually the lower of the 2. It measures the pressure in the arteries between the heartbeat. It measures the pressure of the arteries between heartbeats.
Okay. 20 over 60.
Now, Rashawn's blood pressure is 120 over 60, so his systolic is between the ranges of 110 and 120, which is considered normal blood pressure. You reach hypertension range once your systolic is between 120 and 139, and your diastolic is between 80 and 89. All right. And lastly, we check the oxygen level in the patient. By using the pulse oximetry, we're able to determine the patient's oxygen saturations in his blood. A sensor is placed on the patient's fingertip, and the absorption of red and infrared light is measured. Oxygen saturation tells the percentage of the total hemoglobin that is being carried in your blood. All right.
98.
Thank you. It may seem like a lot of steps to take just to have to wait for the doctor to come in, but the information gathered can help determine what the next steps in your care will be. I thank y'all for your time, and hopefully this will help someone.
Good job, Jay.